Hello students, welcome to Pharma Syndrome YouTube channel and today is our discussion on sympatholytics. I hope you know sympatholytics means these are the drugs oppose the action of sympathomimetics on the sympathetic nervous system. For example, sympathomimetics already present in the body like adrenaline, noradrenaline, dopamine. So sympatholytics are nothing but these are acts as a antagonist of the sympathomimetics. Sympathomimetics means they mimics the action of the sympathetic nervous system neurotransmitters, but sympatholytic means these oppose the action of sympathomimetic neurotransmitters. So here the definition is telling sympatholytics are the drugs, nothing but compounds, oppose the effects of endogenous effects of sympathetic nervous system. So what are the endogenous agonist of the sympathetic nervous system? Endogenous means inside, within the body, like adrenaline, noradrenaline, dopamine. These are the endogenous sympathomimetics, nothing but these are commonly called as catecholamines because they commonly contains a functional amine group as well as they commonly contains a catechol group. That's why these are called as catechol, nothing but catecholamines. So the sympatholytic shows opposite action of the catecholamines in the sympathetic nervous system. So in the sympatholytics, we have alpha receptor blockers as well as beta receptor blockers. First, our discussion is on alpha receptor blockers. So here, two types of alpha receptors are there. Alpha 1 there, alpha 2 there. So based on that, here non-selective, selective, miscellaneous. So non-selective category means these drugs can block alpha 1, alpha 2 receptors non-selectively. Selective means they may block selectively alpha 1, and some of the drugs selectively alpha 1A and some of the drugs selectively alpha 2. Selectivity is there. And here miscellaneous compounds. Miscellaneous compounds means generally these drugs primary action is not alpha receptor blockade. Generally these drugs are having different actions. In this different action, one of the action is alpha receptor blocking action. That's why these are comes under the miscellaneous category. So these are not having that much application in the clinical field as a alpha receptor blocker. That's why these are miscellaneous category. So regarding first non-selective category. Non-selective category, again there is a reversible non-selective alpha blockers, irreversible non-selective alpha blockers. First one is irreversible. So these drugs irreversibly blocks alpha 1, alpha 2 receptors. So examples like phenoxybenzoamine, dibinamine, both are irreversible non-selective alpha receptor blockers. Irreversible means they form nothing but these drugs form covalent bond with the alpha receptors. Next, reversible category. Reversible category drugs are like phentolamine, tolozoline. Phentolamine, tolozoline are the two drugs, reversible non-selective alpha blockers. So these drugs form bonding with receptor, maybe hydrogen bonding as well as van der Waals bonding, van der Waals forces. So both hydrogen bonds as well as van der Waals forces are weak forces, weak interaction. But irreversible is covalent bond interaction, somewhat strong interaction. This irreversible drug blocks receptor for the longer time compared to the reversible category of the drugs. So these are the drugs comes under non-selective irreversible, non-selective reversible, alpha 1, alpha 2 receptor blockers. Next, selective category. So selective category means here drug selectively blocks only one receptor. So here first is selective alpha 1 receptor blockers, all josins. Selective alpha 1 receptor blockers are all josins. All josins chemically contains quinazoline group. Quinazoline group, which is also present in the natural alkaloid Wasaka. Quinazoline is a chemical group commonly present in the josins. The examples like alpha-josin, terajosin, doxajosin, prajosin. All josins are wherever you study or you may study a new drug with josin. So simply it is comes under alpha 1 receptor blocker. Here all josins are selectively blocks the alpha 1 receptors. Alpha 1 receptors are present in the blood vessels. Next, the drug tamsulosin. Tamsulosin is selectively blocks alpha 1A receptors. So alpha 1A receptor is located on the prostate gland. And here next, yohimbine is a natural alkaloid and edazoxin is a chemical agent. Both yohimbine and edazoxin selectively blocks alpha 2 receptor. Generally, alpha 2 receptor location is presynaptic receptors in the central nervous system. Alpha 2 receptors are a presynaptic receptors in the central nervous system. So these are the example of selective alpha receptor blocker. Alpha 1 receptor selectively blocked by the josins, alpha 1A receptor selectively blocked by the tamsulosin, and alpha 2 receptor selectively blocked by the yohimbine and edazoxan. Next, miscellaneous category of drugs. The miscellaneous category of drugs, nothing but here, ergot alkaloids. The examples of ergot alkaloids like ergotamine as well as dihydroergotamine. I hope you know ergot is a natural alkaloid. Generally, its source is fungi. It's sourced from the fungi, and generally ergot contain a indole group. That's why ergot group of alkaloids are called as indole alkaloids. So this is the a simple and easy classification of alpha receptor blockers. You know, regarding your theory examination as well as your competitive orientation, classifications are very important. Thank you. Keep follow our Pharma Syndrome YouTube channel and keep subscribing.